When we first appeal ourselves to others, what is the most pleasant and memorable impression? There are probably various factors, but perhaps the best among them is a smiling face. For a smile, shapes of the eyes and mouth corners are very important. First of all, mouth corners play a crucial role of determining whether someone's impression is good or bad. Often, children look at angry or upset adults' downturned mouth corners and understand that person's feeling. This is how much the shape of mouth corners influence the person's image. It is the mouth corners which have the huge impact on making good impression. If mouth corners are sagging, then it's a sad and angry facial expression. On the contrary, if mouth corners are lifted up, then a bright and gentle image is created. A1 Plastic and Aesthetic Surgery's invention Mouth Corners Lift, i.e. the Smile Lipt, has the complex word lipt, made from adding the words lip and lift together. It means that when mouth corners lift up, a smile is created. This surgical method is a very creative invention brought to you from 10 years of endeavoring. Around mouth corners, there are muscles that pull the mouth corners in 3 different directions. People with sagging mouth corners have strong muscle that pulls the mouth corners sideways and downwards. So this muscle must be cut in order to reduce its strength. If just the skin is removed to shift up the mouth corners, then the mouth corners will move down again. Therefore, weakening the muscle that pulls down the mouth corners and strengthening the muscles that lift up the mouth corners is the important principle of A1 Plastic and Aesthetic Surgery's Mouth Corners Lift. Advantage of Smile Lift is, by lifting mouth corners, the person can have smiling impression without actually smiling. So a much brighter and better image is created. Well then, who should have the mouth corners lift? Patients with sagging mouth corners, patients with short mouth, patients with asymmetric lips and mouth corners, patients with less distinct lip contour, patients that are not confident with their smiles, or those who show gums while smiling. Then from now on, we will listen to a more detailed explanation with Dr. Kwon.
여자 연예인들 중에서
Among
이 꼬리가
female
가장
Korean entertainers, Mina Shin has the most beautifully upturned mouth corners. She has long mouth with upturned mouth corners. Among male Korean entertainers, Soo-hyun Kim has the most handsome mouth corners. Even among ordinary people, some have beautifully upturned mouth corners. Some people with upturned mouth corners form wrinkles other than nasolabial folds that move up along with the mouth corners. This is because the muscle that lift up mouth corners are strong. In general, Western people have longer mouth and higher mouth corners than Korean people. Then why do some people have sagging mouth corners and someone like Mina Shin has upturned mouth corners? This is related to the strength of muscles around mouth corners. The red arrow indicates the muscle that pulls mouth corners sideways. The yellow circle shows the muscle that pulls mouth corner downwards. Mouth corners sag when this muscle that pulls them down becomes strong. Blue circle indicates muscle that pulls the mouth corner upwards. Principle of mouth corners lift is not just about physically lifting mouth corners. Mouth corners will sag again. Like the muscle shown in this photo, when the muscles that pull down mouth corners become weakened and the muscles that lift up mouth corners are made stronger, then mouth corners naturally move up. This is referred to as physiological migration, and in order to prevent mouth corners from sagging and to maintain the results for a long time, physiological migration is absolutely necessary. From now on, I will explain the surgical procedure. This photo is the view before surgery. Mouth corners are severely sagging and deep trough has formed. Here is the design for surgery. When mouth corners sag, it follows the direction of upper lip. So the lifting direction must follow the course of lower lip line, like the way white arrow is pointing. Mouth corners must lift in this direction. This is the view immediately after surgery. Here's another patient. This patient has short lips and downturned mouth corners. Here's the view immediately after surgery. Lengthening of lips and mouth corners lift were done simultaneously. From here on are the photos of patients who had mouth corners lift. This patient is a young female with severely sagging mouth corners. Here's the view 1 year after mouth corners lift. Mouth corners showed the tendency of spreading out sideways rather than lifting up during a smile. However, after Smile Lipt surgery, mouth corners clearly move up when she smiles. Now, I will explain mouth corners lift for middle-aged women. Although mouth corners sagged before surgery, they lifted up into a very ideal appearance after surgery. Before surgery, mouth corners did not lift up even when she was smiling. However, after the surgery, the smile now has naturally upturned mouth corners. This patient had severely sagging mouth corners, so even the smile didn't look beautiful. This kind of smile is formed when the muscles pulling down on mouth corners are too strong. Although mouth corners lifted up after surgery, there needs to be a change in smiling appearance. In other words, once the patient develops the habit of smiling with force at mouth corners, smiling appearance can become very beautiful, like the photo shown on below right. Here is the view before and after surgery. Whereas mouth corners are sagging before surgery, after surgery, mouth corners have lifted up beautifully. This patient had smile that showed gums. It was because mouth corners did not lift up. Like the photo below, when mouth corners move up after surgery, upper lip does not have to move up, so gums do not show. After mouth corners lift, contour of lips change as well. In this patient's case, outline of her lips were not distinct or vivid, but after mouth corners lift, outline of lips changed as well. In other words, contour of lips becomes much more clear. This patient had very short lips. After surgery, even a slightest force on the mouth corners will lift up and lengthen mouth corners. Therefore, changing the facial expression habit can make the mouth corners look even longer than it is from surgery. This patient had thin lips, downturned mouth corners, and short lips. Lip augmentation was done using temple fascia transplant, and lip extension and mouth corners lift were done simultaneously. There are quite a few cases of asymmetric lips like these. Left mouth corner sagged more than the right mouth corner. In this case, sagging left mouth corner must be lifted even more. This patient had sagging left mouth corners due to facial paralysis. Likewise, left mouth corner must be lifted even more. But because this patient had weaker left facial muscle than normal people, effectiveness of surgical result relatively falls short. Some people make facial expression on only one side. Since the left mouth corner is always tense, her mouth looks asymmetric. After surgery, even a case like this can be corrected to some degree. Mouth corners lift for older patients should be decided after much more careful deliberation. This patient had genetically sagging mouth corners with much more severe sagging on the right side, and her overall facial skin sagged, worsening the sagging of mouth corners. In this case, simply lifting up mouth corners isn't very effective. Having face or neck lift with mouth corners lift can produce the desired result. This is a female patient in her late 50s, and likewise, sagging of the mouth corners appeared simultaneously with sagging facial skin. Facelift, neck lift, and mouth corners lift must be done at the same time. For men, mouth corners lift is slightly different than that of women. Mouth corners must lift up to or slightly higher than the horizontal line, rather than as high as the woman's mouth corners. Excessively lifted up mouth corners could make the masculine image rather frivolous. This patient is a male in his 50s with severely sagged mouth corners. Mouth corners were formed to maintain the parallel shape. Until now, I have explained various shapes of mouth corner lift and compared the results from before and after surgery. Then, from now on, I will explain the recovery process of mouth corners lift. Mouth corners lift has very quick recovery. so going outside is possible the day after surgery. Stitch out is after 5 days, and even if stitches show up to this point, they are nearly invisible because stitching thread is transparent. Then the surgical site becomes hard after 2 or 3 weeks, but this is the same for all types of surgeries. However, after about 3 to 6 months, the red coloring on surgical area fades and hardened skin becomes softer. There isn't any special caring required after surgery. Washing the face with water, brushing teeth, and eating are possible the day after surgery. Patients can wash the face with lukewarm water, dry off, and then apply ointment on the scarred area. Another thing to keep in mind is that the patient should be careful not to open the mouth too wide for about 2 weeks after surgery. Next, I will explain the possibility of side effects. All surgeries have the possibility of side effects, and so does mouth corners lift surgery. Incision could possibly leave scars, and surgical area could develop infection or hematoma. Also, in some cases, the red coloring fades away rather slowly, and there could be asymmetry in mouth corners. However, mouth corner lift corrects asymmetry into symmetry, so asymmetry isn't necessarily from the surgery, but from the common asymmetry found in all 2 sets of human body parts. Also, depending on cases, mouth corners may lift less and be undercorrected, or lift up excessively and be overcorrected. Up until now, I gave you an approximate overview of mouth corners lift. Much more detailed information can be found at A1 Plastic and Aesthetic Surgery's homepage or at Dr. Kwan's blog. Links are shown here. Thank you.